We zijn in Amsterdam tijdens het laatste Espghan-congres. Dat is zowat de belangrijkste Europese meeting rond pediatrische gastroenterologie en voedingsleer. En daar vond ook een symposium plaats rond het gebruik van sojavoeding bij jonge kinderen. De chairman was professor Van de Plas. Niet toevallig, want hij publiceerde namelijk deze meta-analyse rond de veiligheid van soja-inname bij jonge kinderen.
The main outcomes was very simple, that soy is safe. At least what we mainly focused is on the safety of soy infant formula for infants, and soy infant formula was shown to be very safe for infants.
Rond een aantal specifieke topics was recent wat ongerustheid gewekt. Zo kwam er de vraag wat de impact is van soja op het reproductieve en endocrine systeem bij kinderen. De meta-analyse gaf duidelijke antwoorden.
For the reproductive and endocrine system, the findings were the same as for the other parameters. It was very safe. No side effects in infants are reported. In fact, side effects that are reported are only in animals when you inject it intravenously, which has nothing to do with the daily clinical situation of ingesting some soy milk.
Daarnaast rezen ook vragen over de verhoogde spiegels van fytoöstrogenen bij kinderen die soja innamen. Ook hier bracht de studie duidelijkheid.
If you measure phytoestrogens in the blood, they are higher than with mother's milk or with cow's milk-based infant formula, but never any clinical effect of these higher levels has been reported. Here the only side effects which are reported is if you inject pure phytoestrogens intravenously in animals, you get negative side effects, but it has never been reported in infants and young children. The take-home message of the meta-analysis is that soy is very safe and that soy can be considered as part of healthy eating habits for infants and toddlers. I think that soy can be safely used from 1 year onwards and that it is part of a normal diversified diet. There is no reason to not use soy in the diet of a 1-year-old child.
Dit is Dr. Messina, een wereldautoriteit op het vlak van gezond gebruik van sojavoeding. Voor hem wordt steeds meer duidelijk dat de proteïnen in soja hoog kwalitatief zijn en dat soja een plaats verdient in de voeding van jonge kinderen.
The soybean has a higher amount of protein than other commonly consumed beans or legumes, and the quality of soy protein is higher than all other plant proteins, and it's actually similar in quality to animal protein. Soy protein is very well digested, roughly between 95 and 100%, and it has an excellent amino acid pattern. So it meets all of the requirements for the essential amino acids or the indispensable amino acids.
Patiënten bekijken soja vaak als één van de vele plantaardige voedingsproducten. Maar de vraag is of we alles zomaar op één hoopje kunnen gooien.
In terms of protein quality, there definitely is a difference between soy and the other plant proteins. So soy is considered to be a complete protein because if you consume the amount of soy recommended by the RDA, you will get all of your essential amino acids, whereas in the case of other plant proteins, that's not true. Now, of course, you can combine plant proteins and come up with a high-quality protein, but soy protein is a high-quality protein in and of itself. Well, the take-home message is really that soy foods can fit into an overall healthy diet. You don't want to focus on one food too much, but soy is a food that warrants a larger role in Western diets. So I recommend that children consume at least 1 serving per day and perhaps 1 to 2 servings, and it's easy to incorporate soy into the diet because there are so many soy foods that are now readily available.
Een derde spreker op het symposium was professor Badger, de man achter de zogenaamde Beginnings-studie. Dat is een lopend onderzoek bij ongeveer 100 kinderen. Ze worden opgevolgd van de geboorte tot puberteit. Dr. Badger wil zo de groeiontwikkeling opvolgen van kinderen die in hun eerste levensjaar gevoed werden met melk, soja of borstvoeding. Op dit ogenblik zijn de resultaten tot de 5 jaar gepubliceerd. En voor professor Badger wijzen die allemaal in dezelfde richting.
I think that soy formula is an outstanding alternative to breastfeeding. We promote breastfeeding as the primary nutrition for infants, but most of mothers feed their children formula in the United States. And soy formula is clearly an outstanding alternative to that. One of the main questions that people ask is soy formula safe? And thus far we've found that soy formula is extremely safe. So we have studied this issue related to the potential estrogenicity of soy and find no evidence that soy produces any estrogenic effects. That's one of the reasons that we're going to also study these children all the way through puberty.
Voor professor Badger sluiten deze nieuwe gegevens naadloos aan bij de reeds bestaande studies. Zo is er het onderzoek over de prestaties van 8-jarigen die als kind al dan niet borstvoeding kregen. Een studie met duidelijke conclusies.
Children who are 8 years old and who were either breastfed or formula fed as infants and were studied at age 8 years perform at least the same. I think the take-home message is that soy formula is an outstanding alternative to breastfeeding. It promotes a very healthy growth profile. The body composition, which is extremely important in very young kids, is actually superior to formula fed in our mind. That is, the children are leaner, bone structure is healthier, and fat composition is lower. And growth characteristics are very good. So we think that that's an excellent alternative.